Hi everyone, my name's Amy. I'm a nurse at Community Memorial Hospital in the emergency room, and I'm also a member of the code team or the stroke team. I'm here today to talk about COVID and stroke. OMG, COVID-19. We're all sick and tired of it. We wish it would just go away. Unfortunately, the numbers continue to increase, and we're anticipating there may be a surge of people needing hospitalization with COVID-19. Fortunately, we've had great support from our administration throughout this pandemic. We've increased our ability to take on more patients, and we have plenty of personal protective equipment. So I'd like to say thank you to the administration for that, and also thank the staff, the doctors, the nurses, the EMTs, the environmental services staff who help keep the hospital clean, all with the main goal of keeping you safe. Okay, so COVID-19 and stroke. Over the last 9 months, we have been able to study this virus, and now we know more about it. We know that people present with the obvious symptoms like cough, chills, fever, sore throat, and others. Originally, we thought COVID-19 was a lung infection, but now we know that it can affect our entire body in different ways. We've started seeing people with stroke symptoms coming in and testing positive for COVID-19. And what they found is that COVID puts your body into a hypercoagulable state. And what that means is your blood gets a little thicker, starts to form an abnormal amount of blood clots. Those blood clots are in our bloodstream and they start to travel. They lodge in the tiny veins in our body. They can lodge in our kidneys, in our lungs, they can lodge in our brain. When they lodge in the small veins of our brain, they stop the blood flow to that area of the brain, and that causes a stroke. We aren't just seeing older people have strokes with COVID-19, or patients that have the risk factors like high blood pressure or diabetes. We're seeing young people have strokes. In fact, the highest risk age group are people 55 and younger. Now, not everyone that gets COVID-19 will have a stroke. We know there's a broad spectrum of symptoms for people. Some people don't have any symptoms, and some people die. We're seeing some folks have major strokes, and other people have multiple small strokes. So what we're asking today is not to delay treatment. If you or your loved one are showing signs and symptoms of a stroke, we want you to come to the hospital. COVID-19 has got us in a pickle. We're afraid to go to the hospital. There's sick people there, people with COVID, and we don't want to get exposed. But we have policies and procedures in place to help keep you safe when you come here. For example, every room in the emergency room at CMH is a private room, so you won't be put into a room with someone else. We have personal protective equipment that we wear to help keep you safe and keep us safe too. We also have UV lights that go into the high-risk rooms and kill all the viruses and bacteria that have been in that room. We have a saying here, and it's time is brain. Every minute that goes by after a stroke, 2 million brain cells are killed. 2 million in 1 minute. I don't know about you, but I can't afford to lose any more. So the sooner you seek care, the better. We have some great treatments here, right here at Community Memorial Hospital. We can give a medication called Alteplase. Alteplase is given through an IV. It goes into your blood, and it finds the clot, and it dissolves the clot, restoring blood flow to that area of the brain. The catch is you can only get that treatment for about 3.5 hours after the onset of stroke symptoms, so it's not very long. The other treatment we have here is called a thrombectomy, and that's when the interventional neurologist goes with a catheter into your brain, finds the clot, grabs it, and pulls it out, again restoring blood flow to the brain. That treatment's available for about 24 hours after the onset of stroke symptoms. So if you started having stroke symptoms today and said, oh, I'll go get checked out tomorrow, it may be too late for some of these treatments. The American Heart Association has launched a campaign called Don't Die of Doubt. And that's a reminder of people that the safest place during an emergency is at the hospital. So we encourage you, if you or your loved ones are having stroke symptoms, to call 911. When the ambulance gets to you, they're going to call us and they're going to tell us that you're coming. That gives us time to initiate our emergency stroke protocol. We page overhead to alert everyone that we may have a patient coming in that's having a stroke. The interventional neurologist is called, the stroke coordinator is called, the emergency room doctor is ready, the emergency room nurse is ready. We have laboratory there to draw your blood and get lab results quickly. We clear the CT scanner so that we can get an immediate picture of what's going on in your brain. So if you start to notice symptoms, weakness or paralysis on one side of your body, facial droop, speech impairment, it's time to go to the hospital. We use a mnemonic, be fast. The B, can you see that? The B stands for balance. A stroke in the area of the brain called the cerebellum can cause loss of balance and difficulty walking. E stands for eyes. Strokes can cause blurry vision or double vision. F stands for face, if you see one side of the face drooping. A stands for arm, if you have weakness or paralysis on one side of your body. S stands for speech, if you have slurred speech, difficulty speaking, or difficulty making sense. And T stands for time, because we know that those treatments are time sensitive. I think that's all for today. Thank you so much for tuning in. Remember to take care of yourself. And remember, we are here and we are ready for you. Be well.